What is magrolimab? Who should get it? And how is it administered?
So, magrolimab is a type of immunotherapy. It blocks this one process in your body that cancer cells use to evade the immune system called phagocytosis. And cancer cells basically tell the immune system, send off these signals saying, hey, don't eat me, don't eat me. And this drug blocks that signal. So then all of a sudden your immune system says, hey, this is a cancer cell, this is bad, and clears it out. Magrolimab is a really promising therapy for the treatment of both MDS and AML, and it's being used in combination with other medications such as azacitidine or azacitidine venetoclax. It's an intravenous medication that has some really preliminary evidence that it is extremely effective, and it's also particularly promising because it's shown effectiveness in certain groups of patients, such as patients who harbor a TP53 mutation that are traditionally very poor risk. So because of that, it may be a particularly attractive agent in high-risk patients who traditionally have a poor outcome, and it may be able to improve the outcomes of those patients.
What are the side effects? What have we learned about magrolimab so far?
So the side effects of magrolimab are that because it attacks this don't eat me signal, it also can cause problems where the immune system can actually start eating the red blood cells. So it causes something called an autoimmune hemolytic anemia. And because of this, it does drop the hemoglobin very slightly initially when you start treatment, although that does improve over time with repeated administrations. We've learned that this drug looks very effective in preliminary data based on phase 2 studies. And now the big question is, how effective is this medication when compared to standard treatment? What does magrolimab add to the current treatment regimen, and how does that really benefit the patient, and how much will that really change the overall prognosis of patients who have AML?
What stage is magrolimab at in development?
Magrolimab is currently being evaluated in numerous phase 3 testing, which is where we randomize patients versus standard treatment plus magrolimab. And it's being evaluated in several different settings in the phase 3 setting. And this will give us very conclusive evidence whether this medication is effective or not.
How can magrolimab change the way AML is treated?
So magrolimab may be able to not only improve the number of patients who are getting a response with the first-line treatment, but it also has the ability to maybe prolong those responses so patients respond longer and survive longer and have a better prognosis. But I think most promising is its ability to really work in a group of patients who are high risk and traditionally don't tolerate therapy very well and do not respond to therapy. And in those high-risk patients, if magrolimab is able to be shown to be effective, I think that offers a large amount of hope for patients who traditionally didn't have many treatment options available to them.